Hello everyone, welcome to another video from the drug delivery lab. We have another paper that just got published. This is on osteoarthritis and treatment using NDGA. So I have two authors with me. In this case, they are co-first authors, Bhagyashree as well as Kamini. Kamini has graduated, and that's why we're doing again this video through an online mode. She's currently doing her postdoc in US, whereas Bhagya is currently a PhD student in the lab. So we'll get started. I hope both of you are very excited with these papers that are out now. Maybe briefly describe what is the motivation of the study?
We all know generally that osteoarthritis is a multifactorial disease, and generally there is decreased autophagy and there is higher chance of senescent cells and all of that. If you think about the pathophysiology that's behind the disease. So while we were thinking about finding drugs that is going to act as a multifaceted, addressing all these multifaceted problems, we found that NDGA stood out as one of the drugs that was capable of addressing the imbalance in autophagy, address the senescence problem, like decrease the senescent cells or prevent the senescent cells from forming, as well as it had the potency to even reduce the amount of ROS that forms, which can be damaging molecules to further progress the osteoarthritis. So we wanted to use NDGA with this motivation in our mind, and we started to think how we can start to formulate this into a suitable formulation. That was the primary motivation for using NDGA for osteoarthritis.
Cool. And I think a lot of this was also motivated by some results we got from human samples, right? From clinical collaborators.
Yes, that is true. When we had these samples from Ramaya Hospital, we found that the end stage knee osteoarthritis knee samples had decreased amount of autophagic positive cells, while the senescent cells were higher in number in places which was closer to the lesion compared to the lesions that were healthier or away from the lesions. So that was also a major motivation.
And they also had higher ROS, 15 LOX, and other mediators. Yeah. Cool. Then tell us more about what was the solution? Why, as a bioengineering lab, we are dealing with drug and osteoarthritis?
So osteoarthritis, if you want to target it, it would be better if you directly give intra-articular injection to increase the therapeutic concentration of these drugs. But the major challenge these face is the rapid lymphatic clearance. So here comes our bioengineering aspect, where we encapsulate the small drug molecules in PLGA like microparticles that increases their retention time in these joints so that they can achieve their therapeutic potential. So in this study also, we tried to encapsulate them in microparticle formulation, and we saw some good result in mice models as well.
Cool. And Kamini, do you want to expand on what results we saw in the mice models?
Yeah, so we first started out as a preventive regimen, the first regimen that we started out, where we spaced out our duration of our study to a maximum of about 60 to 63 days, I think. And we were giving injections at about 21 days, and for that day 21 at day 42. And we wanted to check if these injection regimens, like 3 injections were given, and we wanted to see how the osteoarthritis model will, how the mouse will show reduction in the disease pattern of the osteoarthritis that is expressed. We found that at the end of the study, by using 3 injections, there was a considerable reduction in the cartilage damage that was in the mice that were treated with NDGA microparticle compared to the free drug or even the one that was untreated. So that was a major achievement that motivated us further, thinking that, okay, preventive regimen with 3 doses is capable of preventing osteoarthritis from getting aggravated. So let us try to reduce the dosage and see what would be the minimum dosage that would actually yield a very good result, wherein the injection numbers, the frequency should be reduced, whereas the therapeutic efficacy must be maximum. So we studied a 2 injection study after that, which we named it as the curative regimen, where we spaced out the injections as 2 injections in the whole study period. And that also had very similar results, where the amount of cartilage degeneration was prevented, and there was increased autophagy happening in those.
Yeah. And I think Kamini has some network issues, but maybe I'll fill in for the rest of it. So yeah, essentially we saw that even with reducing the frequency, using these bioengineering approaches, primarily polymeric particles, we could actually get quite a bit therapeutic benefits, even when we are giving 1 month apart injections. And we, in fact, went ahead and did just a single injection. There also we saw some benefits, although with single injection, certain aspects, for example, the bone morphologies and all were not getting as improved as we were seeing previously. So essentially, what we could show is with the bioengineering approaches, we are able to really reduce. We really reduce down the administration frequency, something that becomes a lot more patient compliant and much more amenable for further use. Okay, so maybe a little bit comment on where do you all think we should go next in terms of the future aspect of this? Kamini, can you comment on that?
Yes. To start with, first of all, I would say NDGA has never been used for OS studies at all. So this is a very important thing that we have discovered. Actually, the potency of NDGA as a microparticle formulation. So I strongly advocate that this study should next proceed on to a larger animal model. And if it is very successful in a larger animal model, like in sheep or even in horses, then we should definitely take this to phase 1 clinical trial, because shows quite an amount of promise this time. So I'm very positive about it.
Cool.
We should give it a try.
And then I think, Bhagi, you are anyways taking this forward in your current project. So you want to talk a little bit about what you are doing?
Yeah, so we also want to increase the applicability of the study for further clinical use by using another anabolic therapeutic reagent along with this. Since NDGA is acting on senescence, ROS, and autophagy, it will basically improve the joint environment, and make it more suitable for regeneration. So if we add a therapeutic anabolic agent, that will increase its regenerative potential and make it more clinically relevant where patients come in with more damage.
Cool, very, very cool. I think very nicely summarized for both of you. So thank you for taking your time and helping record this video. And I hope all of you who are listening enjoyed this video. And if you have questions, please feel free to reach out to us. And just wait for the next video next time. Bye.